A lot of digital products can do a great job of containing calls without ever talking to a human. It's not like that in healthcare. I've collected a lot of data on how our Five9 healthcare customers have been using the Five9 IVA, and the data definitely prove.
You are listening to the AI with Maribel Lopez podcast, or AI with ML. If this is your first time listening, thank you for joining. The AI with Maribel Lopez podcast is brought to you by the Data for Betterment Foundation. This podcast shares the stories of the people behind the new world of data and AI. What are they creating? And why does it matter? If you like this episode, please subscribe so you can easily find the podcast again. You can find the video version of this podcast at youtube.com at AI with Maribel Lopez. You can also share your feedback and ideas with me on X, also known as Twitter, and LinkedIn. All links are in the show notes. Extended show notes, episodes, and transcripts can be found at lopezresearch.com/podcast. I hope you'll enjoy the show. Hello, and welcome to the AI with Maribel Lopez podcast. I'm Maribel Lopez, and as many of you in the audience know, one of the areas I've been following closely is this intersection of AI and CX. But we're also starting to review how this is evolving across various verticals. And to go deeper into this, I thought it would be really great to speak with someone who's living that intersection of AI, CX, and in this case, healthcare. So today I'm joined by Roni Jamesmeyer, who is the Senior Healthcare Marketing Manager for Five9. Five9 is a provider of CX solutions in the cloud contact center market. Roni focuses on Five9's healthcare strategy to help health systems, payers, and life sciences move their contact centers to the cloud, but also try to close that gap in patient communications. Welcome to the program, Roni.
Hey, thanks for having me, Maribel.
So we all know that healthcare wants to focus on the patient experience. What we're hearing from the field and they've been trying to do this for some time. So I wanted to get your perspective on what are you hearing in the field in terms of how healthcare companies want to approach delivering a better patient experience today versus what we've done in the past.
Yeah, I think what I've been seeing is that they want to be able to provide the omnichannel experience to their patients. And by omnichannel, I mean provide the options to include texting them, emailing them, using social media, using web chat tools, digital tools, in addition to voice. They've never really had to do that before, but now they need to recognize that those are the other channels to be able to communicate with their patients. However, they still need the ability to communicate or connect those different channels to voice when needed. What I see out there today is there's a lot of great digital products out there, and a lot of digital products can do a great job of containing calls without ever talking to a human. Think of Amazon and how we don't talk to anybody when we order, or we make travel arrangements. And I never talk to a human when I'm making plans to travel. But it's not like that in healthcare. About 20 to 25% of all calls will require a transition to voice at some point. For those calls that are, one more thing, I need to talk to somebody about the dosage of my prescription, or I need to talk to somebody about a side effect I'm having. Can I talk to somebody about that? Or I want to talk about my mother's appointment coming up next. So those require a transition to voice, and there's not a lot of products out there that can do that. There's a lot of digital products out there, but they can't really stitch it all together into a complete call journey. And that's one of the struggles and one of the areas that I work on.
I think this discussion about voice is still very important because sometimes people say, okay, we don't need to do that. But this gets to some of the differences in the different verticals and some of the complexity and some of the empathy and other things that are required in certain industries. You know, your healthcare is not the same as, say, buying a widget, which might be much more transactional, much easier in terms of what it is. So you can have different channels for different things. And the 20 to 25% stat is really quite cool because it does make sense. Even in my own experience, I've had that. You also mentioned the multiple channels, and we all know that choice is very important and continues to be important. And one of the things that we've talked about in the past is actually that, concept of chatbots, virtual agents, digital agents, but it had some mixed successes in the past. And from your
Yeah.
perspective, I'm wondering what has changed that makes IVAs more useful and relevant, so this is the virtual assistant, than it was in the past?
Well, first of all, we need that conversational history because it isn't conveniently provided today. We need it to be summarized. We need it to be in a place where we can find it. And it doesn't need to be manual. I don't want to have to go out and search for it. And right now that doesn't exist because those point products typically have those points, those conversational data points in disparate systems. So we want to bring that together. So virtual agents up-level the technology in doing that. And I think it's a pivotal part of moving towards conversational AI, which is where we want to get to. You want to be able to provide the self-service options. You want to be able to provide the communication channels of choice. You want to be able to collect all that data and route the call intelligently to the right agent or the specialist where it needs to go, or maybe even contain the call without even having to talk to an agent. And that's a great thing. But when the case is that a human does need to be included in the conversation, present the history easily to the agent so they have it right there at their fingertips, and also integrate into the back office in systems like the EHR or their other patient data sources of truth so that it's fewer mouse clicks for the agent to get to do their job, and also have the information there so they don't have to repeat the questions that the virtual agent's done. So most importantly, you want to collect and summarize the information, the call history, so that no matter what channel is used, it's there. And IVAs and virtual technology can stitch all that together to make a nice, neat summary.
That makes a lot of sense. But perhaps we can dig a little deeper. I mean, how do you see healthcare organizations deploying IVAs? And does it vary by type of organization? Like in the introduction, sometimes I think depending on where people sit, they only think of like one aspect of healthcare, but we've got payers, providers, other things. So what are you seeing there?
Well, we lumped it into about 4 areas where we saw AI fit in a healthcare system. One was security, one was patient experience, one was revenue generating, and one was reduced administrative back-end work. And none of them were any more or less important than the other. So just because I put it in a certain category doesn't mean that it was any, they're all super important parts. And some healthcare organizations prioritize those, their needs over other, the other areas. So let's just take them one by one. So security, basically wanted to authenticate. You got to authenticate a lot of calls in security, but not all. So if the IVA can authenticate you when needed, make sure Roni is Roni before you address what Roni needs, that's great. But there's a subset of calls that don't need to be authenticated. If you're just asking for address, location, FAQs, hours of operation, bypass that. So you're not frustrating the caller or the agent, and be able to do that. So there's areas for password reset. Some of those areas where you can also onboard or offboard, give them the credentials or take away their credentials, epic password reset. So those are security aspects. On the revenue generation side, it'll be appointments. It'll be prescription refills mainly. But it also could be stuff like handling referrals, because if you want to handle referrals in a simple way, hey, go see Dr. Smith has issued you a referral to go see Dr. Jones, and you want to make sure those schedules happen. That's revenue. And if you are making your providers happy because they're getting those appointments, because if a provider or a doctor leaves, that's a loss of revenue. So you definitely want to make your doctors and your nurses just as happy either, because that's a revenue loss if they take off. On the patient experience side, it's getting them to the right place at the right time. It's reducing the hangups. It's getting them into a queue, keeping them off a hold. It's basically also maybe stuff like giving them easy access to where information is, providing them information like ancillary services that you provide, transportation, or enrolling them into certain programs that you offer, all of those that can be done to help with your satisfaction scores. And then finally, reduced admin work. That's probably underrated because that's a big one, right? We want to get the agents to not leave as well. There's workforce shortages everywhere, not just on the skilled professional health worker side. So if we can offload those redundant calls, again, authenticate so we don't have the agent doing it. If we can summarize the calls, if we can make sure that the notes are put in the right place, if we can, by being integrated with back-end systems, fewer mouse clicks, like I just mentioned, getting them to the data quicker. All of that will help keep an agent happy. So those are the 4 areas that we saw. And in the payer side, it was member enrollment, right? Because it's all about enrolling members and keeping them enrolled and renewals. And on the pharma side, it would be, drug dispensing and issuing prescriptions and stuff. So all of those.
This actually makes fundamental sense to me. And, we talk a lot in general about reduced admin, but I think when you look at certain industries, this is an industry where reduced admin really does make a difference. And, the way a lot of other industries look at revenue generation is different than it might be in healthcare. And I like the whole connection with what it means for doctors as well, because I think that's an example of people don't necessarily make that connection off the top of their head. So we just talked a little bit about how they're deploying IVAs, but I wonder what types of successes and returns you see healthcare organizations achieving. Can you provide us with any examples?
Yes. So over the last year, I've collected a lot of data on how our Five9 healthcare customers have been using the Five9 IVA and the ROI metrics around it. And the data definitely proved that what I call the juice is worth the squeeze in utilizing virtual agents and virtual technology in your environment. But money wasn't always the driving factor. A lot of it was, right, ROI, but there was a couple instances where, I'll give you an example. We had one durable medical equipment company who was using our IVAs in their mother-baby department. They were dispensing breast pumps out to the expectant mothers, and they wanted to start in a small, finite user base, which that department was, and their real whole goal was to just make everybody happy, because they said we were sending out the information on email. It's all over our website, but yet they were calling us in. They were calling in and asking, and they were tying up the lines that were taking up time to address other urgent calls. So they used the virtual agent to provide that information to the expectant mothers to get the statuses or point them to the website and the emails. And that helped a lot. And their surveys were going up, and they were able to just basically make them happy. That was their whole criteria for owning the IVA. And because of that success, now they're moving towards their urology department and their sleep apnea department, which are a larger group because the IVAs proved themselves. Now, on a clinic side, I had another example of where, because they're so busy and not manning the phones all the time, the IVR that they had currently wasn't getting them to the right location. And so there was a lot of frustration, a lot of hangups. Every time they did a survey, their quarterly survey, they were getting just totally negative results. So they put in the IVA to help ask those questions, got them routed to the right clinics. That was a big issue, getting rerouted and hanging up and having to recall back, but it also reduced the voicemails. They were leaving a ton of voicemails to the point where they had to hire extra help to man the voicemails because they couldn't get the voicemails returned until the end of the day. So that eliminated the extra help that they needed to handle voicemails, because voicemails dropped because the IVA was able to handle the calls. And their satisfaction scores have doubled, and they're going up. So those are areas that weren't really necessarily, well, there was ROI in it because they had to hire some agents or workforce to handle the voicemails, but they really just wanted their patients to be satisfied. There's a lot of other examples in the book too that we'll talk about here in a minute, but that's just 2.
So that what you bring up in terms of, when I think of leaving a voicemail for a healthcare provider, it's never inspiring from a customer experience standpoint. I have to imagine sitting down there listening through, 50 of these and then calling people back and not getting them is actually not a good experience on the other side as well. And I think one of the things you mentioned that may be counterintuitive to the listeners is this concept of, we always think of ROI in terms of like hard dollars and cents, but there are actually multiple ways of thinking about ROI. And as a company and as a brand, you have to decide how broad or deep you want to define that when you're doing your efforts. And you had just mentioned that you'd been looking at what a lot of Five9 customers had been done. And I know you recently conduct a large research study on this. And I was wondering, what were some of the key findings, and did any of the aspects of the research surprise you?
Yeah, so there were 2 aspects that kind of surprised me. One was tuning. I think tuning your IVA is a must. You just can't set it and forget it. It's constantly learning. It's constantly looking for new utterances, new words, new reasons for calling. And then that drives a workflow pattern. And then also, because it's becoming more efficient, you're giving it more work. It's like, okay, now it's taking on that, it's handled that. So what else can we have it do? And we see a lot of that. So there's always, and that's because their tuning is making it more progressive and been able to do that. So that's been a fun fact, I guess, if you will. The other one was 2 areas that I talked to customers, they actually saw their call volume increase with the use of the IVA. And you go, well, that seems weird. And what they found was a combination of the IVA taking a percentage of calls and completely containing them by themselves was freeing up lines for calls that weren't coming in. And the reports were showing that there was also a subset of calls that were getting misdirected. They were either going to phones that were dead, back office phones, or maybe they were calling on published numbers that they didn't know existed anymore and they were going nowhere. So the reporting was able to fix some of the call routing and their call volume would go up. And that was a pleasant surprise. So they didn't know they were missing calls, and now they're actually able to capture the missing calls, which has actually increased their revenue or their productivity. So the IVA has produced that in a couple of cases where you think your call volume would go down. Well, in a couple of instances, it may not, depending on, what they're calling in for. Do you know you're missing a call?
You don't. If you missed it, you missed it, and you don't know you missed it. But the other thing that's interesting about that is, I know a lot of the organizations we spoke with were looking at average handle time, and in some cases, average handle time would go up instead of decrease when they put in IVAs. And that's because the complexity of the calls the agents were dealing with did go up, but actually the opportunity to really satisfy a customer also went up. So from an NPS standpoint, that they might be spending longer, but your customers are happier at the end of the day. So I think those are 2 things to really think about when you're looking at your metrics, right? Because maybe your metrics have to change as a result of putting in these new technologies.
Yeah.
The other thing that we're seeing is, there's just many different places people could start, many different things they could be doing.
Yeah.
So one of the questions I like to ask anybody I'm interviewing is, what advice would you share with a healthcare company looking to embark on an IPA project?
So we just put out this book in late June called AI in Healthcare, How AI Drives Value for Five9 Healthcare Customers. And we talk about the ROI, but we also talk about how you would plan one if you wanted to start one. We even put a straw man plan in there to say, hey, here's things to think about. Here's some best practices that we've seen in the past. And here's a guide if you want to just tackle it, or look at tackling or think about tackling it on your own. But the point of the e-guide really is to just give people the encouragement of saying, hey, the water's fine. I know healthcares are laggards. They don't want to be the first in there. They don't want to be first or second or third. So the book is like, hey, other customers have done it before in healthcare. They're getting real results out of it. Here's a guideline to get you there, and don't be afraid, because it is worth the investment. And that's really the point of is that it's a unique environment, as we all know. Healthcare is super unique, but it's really like, here's some areas that have been effective, and this may apply to you too. So that's what I would suggest. It's a good read if you want to download the ebook.
I'll actually put a link to the ebook in the show notes. Anybody that's listening can actually have direct access to that. Because I think anytime we get an opportunity to have a guide, it's always a good experience to at least have a place to start when you're thinking about things. So many things could be happening with CX and healthcare. And the contact center as a service is a large landscape. So I'm wondering what other ways you see the CcaaS market, as we call it, contact center as a service, improving CX for healthcare moving forward.
I've got like a 2-part answer for that. One is conversational AI is always improving. There's interaction analytics that work and have many aspects to it, as far like the tuning part. It could be analyzing the communication journey to recognize trends, keywords, trends, make it more personalized conversation as time goes on and they get to know Roni, because maybe she calls in, more than once and get to know her. It could also be to score conversations for keywords and tones, like hey, every time somebody calls about this drug, they're angry. Why is that? And kind of be able to be, where are we coming up short? How do we fix that and be able to take the analytics and drive value out of it to be able to correct some of the, make more efficient conversations, if you will. But it also could be dynamic too, right? Like an example of, hey, I want to make an appointment on Thursday to see Dr. Smith. And then the IVA says, well, Dr. Smith isn't available for 3 weeks. Do you want to wait? Well, who is available? I don't want to wait. Who's available on Thursday? Because I need to see somebody, right? So being able to have that dynamic to say, go into the tools and find out who the right skilled professional is that's available at that time and pivot all on dynamically on a call is where we're headed. And it won't work in siloed tools because you need it all to work together and have a unified platform to be able to do it, but we're getting there. So that's one. The second thing I would say about CcaaS that I'm seeing is that I'm finding that contact centers are becoming the centralized hub of communications in the healthcare system. It's not there yet, but as we streamline the tech stack, reduce that because it's unsustainable the way it is to have all these point products. Budgets are shrinking. The data needs to be unified. CcaaS is going to be that central hub, and the reason for that is because it can integrate with the backend systems like the EHRs, the revenue cycle tools, the CRM tools, customer relation management tools. It can also connect to the outbound. It can connect to the remote teleworkers, the remote workers. It can connect to your mobile consumer base. It can patient at home as we move more care to outpatient and patient at home and hospice and post-acute. You can have those connections from a patient journey. And then you're also starting to see it connect to the internal clinical communications, the operator consoles. So you're going to see it. It's the long game, but it's going to play a very important part because voice is not going to go away. Voice will always be there for the reasons I just mentioned. The, oh, by the ways, I must, while I have you, can I talk to you about this? Or can I talk to somebody about this? Voice is always going to be a critical component of healthcare.
I actually hope that we continue to keep the human in the experience for as long as possible and just make it easier for people to do what they do best and for technology to take care of some of the mundane, routine, annoying things, right, that we prefer not to do. Well, this has been great. You showed a lot of insight in terms of what's happening with healthcare. And I usually like to close the podcast by asking a question about whether or not there's a book, a podcast, or an activity that you'd like to recommend to the audience. It doesn't have to be tech related, just anything you think might be interesting that people should know about.
Yeah, on September 19th, I'm going to be doing a webinar with Exact Sciences, which is one of our customers that is mentioned in the book. They had tremendous ROI from their virtual agents. And they're going to talk about that, but they're also going to talk about how they put it together, what their thought process was, and, how they got from point A to point B to point C. And I think that would be very informative for folks to listen to if they're kind of thinking, and want to chew on something. So it's September 19th. I don't know if the link is available or we can post the link on there, but I think that would be informative for people to listen to them. It's their webinar. I'm just going to be sitting on the sidelines.
Well, we'll do that. We'll get up whatever links we can. Roni, I want to thank you for your time and all you do in the field, and we look forward to hearing what you build next.
Well, thank you. Thank you again for having me on this podcast. I'm happy to be here.
Thank you for listening. Additional content can be found at lopezresearch.com/podcasts. Until next time, wishing you all the best.